When did we pathologize joy, euphoria, feeling alive, feeling a sense of well-being? Dr. B 360, and I think this is an important concept to look at. One, it will teach you some critical thinking and the value of any kind of historical analysis. B, in modern psychiatry, in substance abuse and addiction treatment, the term euphoria is has a negative connotation. I will argue that that negative connotation is creating a vacuum where we could utilize the term in achieving better outcomes, especially during this heightened fentanyl crisis and the overdose deaths in the treatment we utilize for medication assisted treatment and otherwise. So let's get started, okay? So let's go back. Euphoria, okay? It's a mental or emotional state, I guess, characterized by a pathological sense of well-being. I don't know what a normal sense of well-being would be, but in modern medicine, it lives in the DSM and the ICD, okay? And it's not a diagnosis, but it is a symptom associated with mood disorders, mania, substance intoxication, neurological conditions, frontal lobe lesions, brain injury, and actually dementia at certain points of evolving dementia. You could see that, okay? That's where it sits in modern medicine. And how did it get there, okay? You can, even if you don't dig deep, you can say, well, normal euphoria, right? One characterization is a normal sense of well-being and happiness, and it's contextually related. What context? And isn't it all subjective? Because pathological euphoria is outside context and an appropriate feeling of well-being, a sense of well-being. Now, unless if you have someone in a fire pit that is just sitting there and expressing to you the calmness that they feel, I don't know how you can measure that subjective thing. And we've seen that problem with the pain scales in the early 2000s, right? We ended up pushing a lot of people into the opiate epidemic issue, and that's a whole different discussion. But, this is important, okay? Let's look at its historical, let's look at its history, okay? In Greek, it meant a feeling of well-being, a sense of well-being, a sense of vitality, being alive. That's what it meant all the way up to the 17th century. Nobody messed with that term and what it designated. It was just one of the ranges of human emotions that are expressed. And it doesn't have to be, it's often associated with mania nowadays. I assure you, mania is nothing like euphoria. A person could just be sitting there calm for days in a Zen meditative state, and that's euphoric, and that's okay, right? I think in 17th century, 1800s, we saw a little shift, but it was still positive, okay? At that time, physicians started to use it when patients were responding to treatment and they were euphoric state. That was a positive thing. Oftentimes it was people in convalescence of recovery, and it was used in that context, which is still okay, positive, right? Around the 19th, 20th century is when you started to see that, and interestingly, that's the birth of modern medicine. You started to see that shift, right, where it was affiliated and associated and designated with pathological states, okay? You started to see it in 19th, again, 20th century. They started to use it, neurologists and psychiatrists, in states where there was intoxication, dementia. At certain points in dementia, you'll see a person with extremely elevated mood, frontal lobe lesions, head trauma, uh, um, uh, and mania. It was often associated with mania, which is silly. And mania itself, number one, it's very different from euphoria, and mania itself has a connotation historically with being enthusiastic about the work you're immersed in, whatever you're doing. So you started to see that shift, major shift into a negative connotation, 19th century, 20th century. 20th century came, and I'm going to skip the first uh, 30, 40 years, but really it's built in to the description of opiate intoxication and other substance of abuse. Now, here's the problem. There's so much stigma around this, uh, uh, addiction, being an addict, using opiates, using drugs, that the term, whatever utility it has clinically, is not even considered by the clinician today or in coming up with the uh, arsenal of medications that we need to use. Why this is important, and here's the punchline why this is important. We are in the age of fentanyl, okay? And I'm starting to make more videos describing this issue in different ways. We are in the age of fentanyl, okay? Fentanyl, and I'm going to be short about it. See my other recent videos on this topic. Fentanyl is highly addicting with little euphoria. Okay. Heroin would have much more euphoria. I'm not going to get into the whys. It's in some of the other videos, and I have upcoming videos describing it. That being the case, it's addicting. People use it more. They become addicted much quicker, and they have a higher chance of overdose because of that potency. And they can't stop, and they won't go back to heroin. There's no heroin around. Our treatment, we have Suboxone, we got methadone. Methadone is difficult to access for what it's worth, okay? But Suboxone is much more readily available. The problem with Suboxone, which I've always been a big fan of, and I still am, and the way I would describe it many years ago is, methadone is great. It's a good drug, but safety profile and abuse potential, we're going from an older crappy drug to a newer drug, which is buprenorphine Suboxone product. And my thought on that was, most people should first attempt to get on Suboxone. And if there's failure, you go to the bigger guns, okay? And those bigger guns come with some more liability than Suboxone in terms of safety, abuse, diversion, and so forth. That's always been my position. The last couple of years, I think that methadone is back in a place of much more importance than in my mind has been in several years, because methadone, although it's not a great high, it covers that euphoric state much better than Suboxone does. And what that translates into is when someone's highly addicted to something like fentanyl and you want to put them on, replacement therapy, you want to cover as much of that euphoric state as possible to facilitate recruitment of the patient staying on medication assisted treatment. See what I'm saying? There's this space where we can call euphoria when someone's using opiates. It sucks actually in fentanyl. It's better in heroin, but fentanyl is a lot more potent, short acting, deadly. So that potency, it becomes almost like, I heard a patient once describe it a rat race. You're just dosing all day and, it's not that great of a high. All right. Well, we would need something that covers that space a little bit better than Suboxone, because once they come off of that highly potent fentanyl, they need everything that we have to be able to keep them off of that deadly street fentanyl. And although Suboxone works for many people, it obviously doesn't work for everybody. People have a difficult time going through the clinical opiate withdrawals to get on Suboxone. That's number one. And then once they're on it, there's cravings and withdrawals are covered. Now the question becomes, at some point, what does cravings mean? And that is a spectrum. And somewhere in that spectrum, you can throw that term euphoria in, and Suboxone sucks for euphoria. But in American addiction treatment, it's a taboo term, and it's a non-player in consideration of treatment. Here's my thoughts on euphoria. I hope you followed. I hope it makes sense. I hope it gives you more things to think about and consider. Please leave your comments below. Don't forget to like and subscribe. It means a lot for the channel and our growth, and pass it on. Talk to you guys soon. Peace.